Hi, everyone. I'm so glad to have you here today on this podcast. Today, I am excited and honored to have Dr. Nadine Macaluso with me. She's known to her patients as Dr. Nay, and she is the real life inspiration behind Naomi Belfort's character in The Wolf of Wall Street. She survived a turbulent 8-year marriage to Jordan Belfort marked by abuse, greed, and trauma. Following her experiences, Dr. Nay relocated to California. Her journey of trauma and healing inspired her to return to school at the age of 39, where she earned her master's in counseling and a Ph.D. in somatic psychotherapy. She further specialized with a 2-year postdoctoral training in the Neuro-affective Relational Model, NARM. As a therapist, Dr. Macaluso combines her education and personal experiences to help others heal from trauma. Her practice focuses on assisting patients in connecting with their authentic selves, fostering confidence, resiliency, and agency. Dr. Macaluso firmly believes in the potential for post-traumatic growth, instilling hope in her patients and guiding them to reach their potential in life and love. I am so grateful to have her here. I have to say, this book, she is a trailblazer. This book, Run Like Hell, if you do not have it, I strongly behooves you to get it because this book is all about trauma bonding. And Dr. Nay has been a trailblazer in getting us to really begin having conversations about how trauma bonds are formed and the reality of the lives of people, victims, and survivors living within a trauma bond. So thank you so much for being here, Dr. Nay.
Oh, thank you so much for having me. I look so forward to this conversation. Let's do it.
Let's do it. Okay. First and foremost, I think maybe not everybody knows who you are, even though we would think that people do. Can you tell us a little bit about yourself and how you came to this work?
Yeah, sure. So I was married to the infamous Wolf of Wall Street. So I was living in the quintessential trauma bond 25 years ago, but I didn't know I was. I knew I was in a very dysfunctional relationship. But I left him and then I moved with my 2 children to California. And while I was with him, he was so crazy that I put myself into therapy. So therapy has been a very big part of my life. But I moved my children to California. And at 39, I decided to go back to school to be a therapist because I believed that therapy had saved my life. And while I was doing that, he wrote a book and made a little movie, right? And then what happened was all these smart, kind, beautiful, amazing women were coming into my office trauma bonded. They were either experiencing coercive control, they were being physically abused, emotionally abused, verbally abused. And I just thought, this is a problem. And so hence I went back to the research and I wrote my book.
Amazing. Amazing. Yeah. I think one of the things that you and I have talked about before is this is such a prevalent problem. Like, we want victims to know that they are not alone. Obviously, you and I are survivors of this abuse. And who would have thought, right? Myself, an educator since the age of 19, you, this woman who goes into this relationship, and then all of a sudden, this person isn't who you thought they were. This is what happens with abusers.
Yeah, this is what happens. And especially, like I was saying 25 years ago, really nobody was talking about this. I had no foundation, I had no terms, and I had not grown up with abuse. So I wasn't the typical domestic violence woman. Not to say there's necessarily a typical one, but the research said if you experience abuse as a child, you're going to experience as adults. That wasn't the case. So I had never seen rage. I had never seen all of this pathological behavior, and it was shocking and scary and traumatizing.
Absolutely. You just said something that really piqued my interest because it's this idea that we do have this belief that if a woman is in an abusive relationship or a man, but that
Yeah.
there's something wrong with them. How did they get into that relationship? And as my podcast is called Perfect Prey, because I say that perpetrators actually choose us, right? And you write about that in your book. Can you explain a little bit more about that?
Yeah. So in 2019, I read Sandra Brown's book, Women Who Love Psychopaths. And it was like I was struck by a lightning bolt because she talks about how women women who are perfect prey for pathological people. And there's an assessment called the 5-factor model, and it measures openness, agreeableness, extroversion, conscientiousness, and what's
Neuroticism?
thank you. Yeah. And so what her research showed was that women who score high to very high in agreeableness or conscientiousness are perfect prey for these pathological people because, and I score very high in both, because agreeableness makes you loyal and tolerant and open-hearted. Conscientiousness makes you very driven and very organized and longing for integrity. And so these are all great traits, right? If a woman comes to me with these traits, I'm not going to therapize them out of her. But in the hands of the wrong person, they get weaponized. And it really, when I read that, it empowered me and it released so much of the shame, even that I still felt about being in a trauma bond.
Absolutely. I think that is key, right? How many times do victims and survivors then maybe go to their therapist and their therapist tells them maybe that they're codependent or that they might have low self-worth, or in society we think and believe that, right? You've had that experience too.
Yeah, that you're a love addict. And that's one of the reasons I wrote my book, because I wanted to turn the mirror on the stigma, turn the stigma on its head, because I was so sick and tired of everybody saying, why does she stay? It's just, no, it's a trauma bond. You are bonded to that person. You are emotionally attached to that person, and stop blaming the victim.
That's right. Can you explain a little bit more about what the trauma bond is then?
Sure, sure. So a trauma bond is emotionally dysfunctional relationship between two people, right? So it's a toxic experience and it has to have two conditions for it to exist. And the first one is a power imbalance. So you can have a power imbalance because, like with me, my ex had more resources. Power imbalance can be because of a parent. It can be simply the fact that you love somebody, they have power over you. And the second one is intermittent reinforcement, which is a behavioral pattern of the perpetrator being very rewarding and loving and kind sometimes, or being very controlling, abusive, and cruel. And actually, those two extreme experiences create extreme feelings inside of us that actually bond us to this person.
So this is why when a perpetrator maybe has done something really horrifying, but then comes back and says, I'm so sorry, or won't you forgive me, or we have a beautiful family, or let's go to dinner. This is why victims will try. And I'm guessing, when I think I've talked about this in one of my own podcasts, but this idea that because of the idea of wanting this relationship, we're fixers naturally. We are conscientious. So if somebody says they're going to try again, we actually are loyal to a fault and think they might actually be willing to try again.
That's right. That's right. And I always say that hope is the hook.
I like that a
It's
lot.
just dangling that hope. We say, okay, because we're also pro-social beings. Like, we believe in relationships. Our whole lives are about relationships and fostering and saving them. And so that gets weaponized against us in a trauma bond.
Absolute. Oh my gosh, that just like resonates so much because it does get weaponized against us. All of the super traits that we have, that
Right.
I think that's helpful for victims to hear. Listen, you're probably a pretty amazing person if you've been
Right.
with an abuser. At your core, you are a really good, kind-hearted person. And that actually is your gift. And if the world were made of more people like this, we wouldn't necessarily have the problems we have in the world.
Right. We'd be out of work, you and I.
Yes, we would.
But that isn't the way society has. And that really just gets me angry.
Yeah, because victims are pathologized, right? And diminished, and also, of course, not believed. And again, like you said, we ask, why did she stay instead of why did he abuse, if we're talking about a man?
That's right. That's right.
Yeah. There's a lot of shame in all of this. There's shame in a trauma bond because when you go back, maybe you told your mother, your sister, your girlfriend, you're leaving him, you're done, and then you end up going back. How do you help your clients with the shame that they're carrying?
Yeah, and shame is just it's just such a, I don't even think of it as a feeling. I think of it as a process. It becomes a whole way of being in the world because, like you say, you're getting abused, you should leave, and you feel like you don't have the willpower to leave. But it's much more psychologically complex than that. And plus, then you also have the perpetrator shaming you. And women just come to me riddled with shame and self-blame. And so what I do is I find out what their shaming statements are, because we all shame ourselves. And so I say to them, here's the good news. Since you're the one doing it, you can stop shaming yourself. Why don't we find an opposite affirmation or validation that you can say to yourself instead of saying that one? And they just get very relieved because they see a list of shaming statements. And I'm like, it must happen a lot if I have a whole universal list, right? And just telling them that it's not your shame to carry. It's his shame to carry, not yours.
Yeah, that's so validating. And I think it's hard to actually integrate when you've for so long been told you're the problem. The abuser does that, like you said.
Oh,
Everybody's doing this to the victim, right? The police do it, or the courts do it, or whatever,
right.
right?
That's
Yeah.
right. And they love to blame us. They could cheat, they could lie. I'll tell you this crazy story. I literally, and I think it's in my book, one of my patients, her husband was laying on top of another woman, took a picture and said to her, "You made me do this." Okay. This is how much they blame and shame us.
Yeah, yeah. It feels to me like, I mean, we can go down the rabbit hole of patriarchy, but right, like in general, men often feel like they have the ability to have power over people. And it's sad because that's not the way that we should be raising our boys and our girls. We should be raising everyone with this idea that there's equality and that everybody in society deserves to be treated fairly and kindly. But again, that's probably another podcast.
Yes,
Um, yeah. So, can you talk a little bit about the trauma bonding that children might experience? Because this is something that was near and dear to my heart. I try to explain to mothers, you've experienced this coercion and control for a long time. You went back several times. You wanted to disassociate from it over and over again. Yet sometimes it's hard for these moms to recognize that might be why their child is doing the same exact behaviors. And except that their brain is developing. So there's so much more compromise than an adult would be in these circumstances.
yeah. And this is such an important topic because before I had known about your work and I was really just working with the women, I was overwhelmed. I can think of one client in particular who left this very abusive relationship finally. And then when she finally leaves him, her older daughter just starts being abusive to her and her sister. She could barely recover from the trauma bond. And then she had no skills or tools really, because she was just still so decimated from the trauma bond to deal with this young child. And then, thank God, I learned about your work. And I was like, okay, yes, there has to be a system to deal with these women because it's destroying families.
Yeah.
And I understand why the older child identified with the aggressor.
Right. Because there is a trauma bond there, right? You and I have had this conversation before, but children are going to oftentimes go to the person who has the most power because that, even though they know they're not safe, it feels safer.
That's right.
Right. And so that's a challenge for protective mothers when they're dealing with their children coming home being abusive in some cases, like behaving like the abuser.
Yeah.
I always say that's the abuser's goal. Like the
Yeah.
abuser is purposefully sending the children back to you to like coerce and control you. That's what the abuser's hoping they do.
Yeah.
And so
Yeah.
if they can create that in the child and the child projects that onto you, then if you're reactive, sadly, and you're in that trauma mode, that's not helpful to the child. It's almost, I always say to my moms, you almost have to be like an actress on stage. Pretend the child's not yours. Pretend it's your neighbor's child who you're taking care of and they're behaving in such a horrible way. How would you react if it was someone else's child, not yours? Because when it's yours, it's personal.
Are emotionally attached to the situation.
Mhm.
Yeah. And it makes sense because the child is just another very effective way to have coercive control. So these men, they use, exploit, betray everybody, right? So now they're using the child as a tool to come home and control the
Yeah.
mother. So how do you work with the mothers? Because I really want to hear about what you do. What's your process?
I think it's always about strategies and coming from a clinical perspective. I try to make them almost like therapists in their home. I always say, and you and I, again, we've had this discussion, there's gaslighting by therapists all the time,
Oh, yes.
right? Our clients go, maybe we could talk about that, like the idea that our clients go to therapy and they're diagnosed with anxiety or depression, but nobody's looking at the problems in their in their relationship with their partner. And
That's
it's such a horrible experience, and then they're often, again, diagnosed with self-esteem issues or codependency. We'll definitely get back to that, but can you speak a little bit about the codependency issue that you and I think is just horrifying?
it is horrifying, especially because I think about my little 26-year-old self and or 27, 28 when I finally was really mustering up the strength to talk about all of the abuse and coercive control and just how traumatized I was by this rageful addict who was just going nuts every single day, basically at me. And when I went and spoke to all these clinicians, they're like, oh, yeah, because you're codependent. How the hell is his abuse and drug addiction my fault? He would have been an abuser. He would have been an addict. No, it wasn't because of me, but because I'm so reflective and I have those super traits, I'm like, okay, it's me. It's me. I got to fix myself. I got to fix myself. And not that there wasn't value, but I was already in therapy, by the way. Not that there wasn't in value in me being more reflective about myself, but they totally missed the mark.
Mhm. And they
And that happens to so many people all over the world and countries still today.
Yeah, it's really frustrating to me. The idea that and then children can go to a therapist and they can actually, like, go there and be afraid of the abuser, so say bad things maybe about the protective parent simply because the abuser wants them to.
Yeah.
It's like a cult. It's like these children become indoctrinated into a narrative,
Yeah.
and I tell protective moms when they come home, like, you have to predict, what are they hearing at the other house about you?
Right.
Because imagine you're hearing your mother doesn't really love you, or imagine that you hear that, oh, your mother likes your brother more than you. Like, how does that impact a child's self-worth, right? They devalue themselves. So in that, the abuser's able to, I call it fire in the stomach. Like, he actually adds like more fuel to the fire. He compromises them over and over again. Then they come home, they projected all this fear and shame that they're carrying onto the protective parent. Predict it. It's not hard to predict what these abusers are saying.
Yeah. They
What
all went
these
to the Hogwarts School of Pathology.
They did, and Amy Blacko and I talk about it in our book Frame, The Abuser's Playbook. They have a playbook. And so what are they saying? And then also, now prepare yourself. Like, going back to what I said a few minutes ago, like, I ask moms to be therapists in the home. You're the best therapist for your children. You know them better than anyone. You can actually regulate yourself. I always want my clients to see someone to support them with their own trauma, someone like you who really gets it. Has to be someone who gets it, right? You know how many therapists don't actually get it too,
Right.
but someone who gets it and then supports them, and then they can prepare for what, like, when they can come up with that prediction list. Now let's prepare what your response is going to be. Like, use the empty chair, practice how you're going to regulate yourself in that moment so that you're
Yeah.
better able to protect. That's
Right.
what I try to fortify them with that. So that way, when the child comes home, they're not thrown, because the child's trying to throw them for a loop, just like the abuser was always trying to keep them on unstable footing.
And it's so hard when it's your own child. And that's why it's so good, the work that you do, because they really do all like really need to be trained as to how to deal with it, like a step-by-step way, because they're managing themselves and they're trying to heal themselves. And then they get abuse thrown at them by their own child. And I think what's happens too, what I've seen with some women, and I totally understand this, they lose sight that it's a child in that body because the child's almost acting like an adult, right? Because they're identifying with the aggressor. And it's no, there's still a little wounded child in there. Respond to that as the parent.
And I think the greatest healing, and I'm sure you would agree, is when we actually are healing ourselves after these relationships, but we actually can see our children healing. There's no greater gift than knowing that your children are not carrying this trauma to the next generation. Yeah.
It's nothing better. Yeah, I had my daughter here who's a therapist and my grandson who's just a year old and her husband. It was my grandson's birthday and watching her be with her husband and her baby and they're albeit imperfect, but they're functional. He's not trying to control her. She's not trying to control him. They're equal parents. They're equal in the home. they're doing everything as equals. And I'm just like, wait.
Yes, we did it. That's amazing. That's the story that I think protective parents lose sight of the fact that if they have an 11-year-old or a 14-year-old who's trauma bonded, they lose
Yeah.
sight of the fact that they actually can have influence. And there's so much influence a protective parent can have. So much
Yeah, but
influence.
but that makes sense, Christine, when you think about it, because they couldn't have any influence in the trauma bond, right? No matter what they did, if they dyed their hair orange, yellow, or purple, or spoke a different language, or no matter what they did, they couldn't affect change in the partner. So I could understand how much it would be tough for them to believe, no, you can actually influence your child by being regulated and staying calm and validating them and just like actually being a parent.
Yeah. Don't you think sometimes our work is sometimes we're like cheerleaders? We're just trying to just cheer someone on and really affirm for them that they do have this strength, this underlying strength. That person totally eroded from them. That trauma bond literally pulled apart. And,
Yeah.
but that they actually do have that ability. And I think to your point, people forget that they can get back on their feet. And because it's so overwhelming and distressing, there's nothing harder. If people always say, if he had just hit me.
Right. Oh, that's a big one. If he had just hit me. Yeah. And even for myself, I think when I got kicked down the stairs backwards, I'm shocked. Thank God I didn't crack my neck. I think that was like a defining moment for me. Now, there had been years of screaming and yelling and abuse and drugs. But that moment really was like, okay, I am in danger. I am in danger here. I could not live. And that's me.
Yeah. So that was when the trauma bond really severed for you then.
Yeah, that really was it. Because I think because of my conscientiousness, and this is my own grandiosity that I have to own, I was like, oh, I can manage this. I can do it. We love each other so much. This will get fixed. This will get better. And that was like, sister, I know you're not fixing this. And yeah, that was the beginning. That was one of my last straws. That was the last straw. The other one was when he had no remorse for what he had done. And then I always say I was lucky he got arrested.
Yeah. He might have pulled you back in though, right?
Yeah, he might have, but see what happened, then the power balance got equal once he got arrested,
Yeah.
window to leave.
Yeah. I love your statement. Hope is a hook, right? Because there was nothing to hope. He was arrested now.
Right. He
That's
was
it. Like,
arrested, he had been violent. And so it was so clear, right? Because when you are the victim of a trauma bond and they are shaming you, I was like, is it me? What am I doing? What am I not doing right? But then it was so clear. No, you're bad and you're okay.
mhm. Yeah. Yeah.
Made it easier. I always say that was a bit of a luxury for me.
You went through enough to get there to the luxury. Yeah.
That just it made the escape cleaner.
Hmm. Yeah. Yeah. And your children are doing well. And
They're doing great. They're
that's the
doing
win.
great. They're wonderful functioning adults, and I love my work, and I get to help women everywhere every day. It's so wonderful and so fulfilling. And I'm patient with them because it's a process when women go back 4 to 7 times. And whenever I get frustrated, because I am human, I say, Nadine, your therapist sat with you for 8 years.
Hmm. That's right. That's right. Yeah. Yeah, no, thank you so much for all of your work. Your book, Run Like Hell. Everyone should read this book, A Therapist's Guide to Recognizing, Escaping, and Healing from Trauma Bonds. You read this book, you're going to say, oh, wait, I guess I am in a trauma bond. Oh, wait, this is how I could possibly get out of that trauma bond. So I highly recommend this book to all of my patients and to anyone out there listening today. Thank you so much, Nadine, for being here today.
Thank you, Christine.
All right.